I find different about Defy is the client-centered and active approach. So you can come in to Defy if you're the average person who maybe is more sedentary or not as active and you want to become more active. You can come in as someone who already does a certain level of activity, or you can come in as a high-level athlete.
It's an open concept environment which caters to the athlete mentality. Seeing other people who are on the same journey as you and working to better themselves is encouraging. You know that you're not alone. You're not in this treatment room the whole time. You see the community members getting better, and that changes your mindset a little bit.
Unfortunately, most of our interactions with people are once they're already injured and they're down that injury cycle, and it's going to take potentially weeks or months or sometimes longer to kind of get them back to where they need to be. And anybody who's active is going to know that things might feel a little bit off. And if we kind of address those things at an earlier stage, we can kind of think of it from a prevention standpoint. You're less likely that you're going to miss time, miss a race, miss some of your workouts, and kind of not get to that chronic stage where things take a lot longer to come back from.
I'd say one of the biggest things is the space that we have available and the equipment. Just getting people back to their full capacity and being able to put people underneath the barbells we have, and being able to do turf work as well, to see if they're really ready to go back to their sport, their activity, and not just send them off on their way and test it on their own. It's the one-on-one, I'd say, was the other factor, that we're not quickly rushing through and then handing them off to assistants. We're working one-on-one with clients and making sure that they have the dedication and attention to the exercises, to the manual therapy.
Bridging that gap between the traditional rehab model and getting people back to the things they love to do. So we have the gym here, we have the space, so we might as well kind of see how people move, and it's really kind of opened a lot of doors in terms of seeing people from outside of the sitting on the bed perspective. You really can see how people move within a gym space.
Defy is definitely client first, people first, and just trying to get the best for everyone that walks in the door.
Everyone wants to achieve the same goals. Everyone wants to see their clients reach that celebration that we all think is so important for each individual client.
Defy is this beautiful kind of amalgamation of athletic and clinical base, because we have that gym in the back and we're encouraging people to move, and we're encouraging people to, you know, you see the other person do that, oh, I want to get to that movement too, you know? It's almost like a competition with yourself to get better. And even as a therapist, like, you see people doing stuff, it challenges you to be better. So I find we're always challenging ourselves to be better, and that's what's beautiful about Defy.